Hello, everyone. I'm honored, and you can see the happiness on my face, the happiness and excitement, because I have none other than Dr. Conrad Fischer with me, a man who does not need any introduction in the world of med ed, and especially one of the best things which I like about him, his advocacy for IMGs, and he actually walks the talk of the DIE, diversity, inclusivity, and equity. Thank you. Good afternoon, Dr. Fisher. Thanks a lot for sparing time out of your very busy schedule.
Oh, well, shukriya, bhai. I'm very happy to be here for sure. Okay. I love making new partnerships and new investigations. And you're such a sincere up and coming educator that this is natural to have recombinations. And let's start the journey and see what we can see.
Absolutely. Thanks for your kind words. And people who don't know this thing about Dr. Fisher, he is pretty fluent in multiple languages that includes Urdu and Hindi. So if you are a resident or interviewer just passing by him, be mindful. He can understand.
You've just picked up on it. I know just enough to make people think I can understand everything they're saying.
All right, Dr. Fisher. So again, without any sugarcoating, we will be asking questions because the one thing that I have always admired about, in addition to all of your wonderful lectures that helped me during the med school, and not me, hundreds and thousands of people all over the world, from especially from Pakistan and India, I know of. So the one thing I really like about your role in the medical education is that you are brutally honest, and that is not something that I have personally observed in people who are sitting as high at the top of the food chain as you, because a lot of time people have some diplomatic answers, but your answers have always been very brutally honest, not brutal, brutally honest. It could be brutal for some.
It could have been worse. You could have said abusive.
No, and again, you're right, it could be for some. I mean, everyone has different tolerance or perception. So I will start by asking one very common question. I mean, and it's not even for applicants, for everybody. So you, as compared to some of the other program directors, you have an inclination towards IMG. What is the main reason for that?
The two ways to look at why I've had so many IMGs in the program, one is practical and the other is more spiritual and philosophical. On the practical end, there is only one medical school for all of the boroughs of Brooklyn and Queens in New York. The boroughs of Brooklyn and Queens in New York individually have populations the size of Georgia, the country of Georgia, and the country of Armenia. And there's one medical school, but there's about 15 internal medicine programs. And the people there at that medical school in Brooklyn are looking to go to Manhattan. So one is numerically.
Mhm.
The second thing is that the Americans that would come here and come to this very, very poor neighborhood are often the last people in their class with the lowest abilities. And we don't take our sense of identity over national origin, either from medical school or birth or things like that.
Mhm.
Now, the philosophical, spiritual point of view is that Conrad Fisher's America, someday I hope to have that be a mini series, is one that is welcoming of everyone based on ability, based on the content of their character, based on the ability to work, and is not based on national origin, ethnicity, religion. It is based on simply who's the best. It's really like the Olympics or a
Mhm.
professional sporting team.
Mhm.
Who's the best person? You don't care where they came from. You want to win.
Absolutely.
And
Absolutely.
that is because America as an idea is not supposed to be fearing people
Mhm.
that says, well, when you teach a person to hate and fear others because you lead them to believe that they're going to threaten your job or your livelihood, we become lesser people when we teach people that. So that is both the practical and the philosophical.
I I really love the second one more actually. And so now people are getting more and more scores, not only IMGs, it's AMGs, so MGs, DOs, IMGs all over. Uh, I applied back in 2015-16 primarily to psychiatry. At that time, if someone had 240, 250, that was like, oh, wow, that's a good score. But now it seems like to 60, 70s, and of course, we had that fiasco of invalidation. Now, I will ask the questions and we can divide it in two parts. So, the things you consider to offer interview to applicants, and then things you consider after interview, and then what are the factors you consider to offer a pre-match. Again, everyone knows, those who don't, that Brookdale is part of One Brooklyn now, and Dr. Conrad is also, you said, vice chair, and they want to make you the chair of the whole internal medicine, right?
Chief infectious diseases.
Chief in fact. And so one Brooklyn is Brookdale and Interfaith, right?
Correct. And it used to have a third hospital called Kingsbrook Jewish.
Yeah.
That training program was closed.
Yes, and I think the hospital was closed too, right?
It was because there
Now,
are several hospitals very close to each other. So that one was closed and only some of the outpatient is open.
yeah, and I remember I used to shadow a cardiologist, Dr. Hassan Dogar, and he used to go and see patients there. So actually, I have been to that hospital, and I remember that. So, Dr. Fisher, uh, again, your program must be getting anywhere around 4 or 5 or even more, 4 or 5 thousand applications, or even more.
5,200.
Yeah. Okay. So now, do you, it's maybe a stupid question. Do you review all of them by yourself, or do you have a team?
Well, I think the one way of saying what I personally do versus saying what are the standards around the country, because mine is only one of 400 training programs in internal medicine and one of 8,000 total programs if you include, radiation oncology programs that have two people in it. So if you have, let's say, radiation oncology and you have two positions and you get 25 applicants, you can look at every single one yourself and you can look into research and look at the quality of the publications and you can dig down like that. But when you have programs that are like family practice, medicine, some of the pediatrics in some places, some of the bigger psychiatry programs, it's very hard to do that. So
Absolutely.
many faculty will have even their program administrator make filters, and the filters choose what that particular program values. So, for instance, some programs may say, get me all the US grads. And some programs may say, well, let me get all the US grads above a certain USMLE score. And or some people may say, give me a program like the people who have visas and don't have visas. So we do have a higher cutoff for people who have visas because there's so many. So as an example, you can't read, nor would you want to, if you have 5,000 applicants with three letters, 15,000 pages of letters.
Yeah, absolutely. That's
This would be
impossible.
what they call in Guantanamo Bay an enhanced interrogation technique, but ordinary people call torture.
I agree. Okay.
So, also reading the personal statements to choose people. The problem with personal statements is that how much do they really tell you about how someone's going to work as a doctor?
Yeah.
And also, we have that brand new. I saw a guy had a really great personal statement. What was his name? Oh yeah, Chat GPT. That was his name. Called him Dr. GPT. Hey Chat.
Yep. And it's not only that, it's the Gemini now. There are at least 5 or 6 of them, and most of them are free, at least their basic versions.
Yeah, like I called him Dr. GPT, and he said, no, no, no. My friends call me AI. For someone who wrote the personal statements. So also digging down into research is really hard to do to give that type of review.
Mhm,
So the most common filters are schools, scores, visas.
mhm. Okay.
And so if when we set, as you said, the grades have been going up.
Mhm,
And 5 years ago, we would set the filter to say above a 240 was like great. That was a great grade.
mhm,
Give me everybody above a 240. And now We have 2,000 applicants that had above a 250.
Yeah. Oh my God. Wow.
Now, the problem we have is without step one grade, the tragedy is too much emphasis on a single data point for many people.
PK. Yep.
People should not be measured on their performance in a single marriage or a single test.
I agree. Anyone can have a bad day. I
Okay, it
totally
can have a bad day,
agree.
exactly.
Okay.
But people still need to know that, though. Now, the advantage that IMGs have is that IMGs can take step three.
Yes.
And that is something that is very important for people to know because it means that the international grad can have two data points.
Hmm.
The second thing is if you need an H visa, step three is indispensable.
Yep. It's mandatory. Yeah. That's
The
mandatory.
next thing is even without needing a visa, program directors like it when you have step three passed because they don't have to worry about whether you're going to make it during your residency.
And Dr. Fisher, I have talked so much about this specific thing. I did my residency out in upper Midwest, and I must say that I have seen actually people failing step three during residency. That happens. People think that never happened. That actually happens. So that is something that that's what I tell people. And a lot of time what people would say, oh, that is like discrimination. And I said, and that's what I say, no, it's not discrimination. It's all about survival of the fittest. If you are an IMG and if you have time and resources, then why not you take it?
What's is 100% sound advice. And that is if you are measured on a single data point,
Hmm.
people who tell me I'm taking the test in May or June, I think are making a dreadfully bad decision. So I say to people, well, if you had the ability to take an extra 2 months to study and you managed to turn your 239 into a 241 or your 249 into a 250, the cutoffs are often uneven numbers.
Yeah.
This is a huge difference.
Hmm.
And so, or you can look at like at one of those game shows where they say, give you a shopping cart and see how much you can put in the shopping cart in 1 minute. And this guy goes, nah, I'll just do whatever I can get in 30 seconds and call it a day. It's like, no,
Yeah.
okay. Rudyard Kipling, to fill the unforgiving minute with 60 seconds worth of distance run.
Mhm.
Fill the unforgiving minute with 60 seconds worth of distance run. The other thing is that you don't want to, like the same way we don't want to die with a gas tank marked half full. We want to die with the gas tank marked empty.
Hmm. Absolutely.
Michael Bloomberg, which is the most philanthropic billionaire in the world,
Mhm.
Michael Bloomberg, our former mayor, said that the check to the undertaker to the funeral home should bounce. Spend it all. And so that is, I was just actually my own son when he was taking step two said, "Well, I'm going to take it in May because I want to enjoy my summer." I go, bro, if you take it in May and you get a 229 or a 239, you're not going to be enjoying your summer.
That's a sound advice.
Now, what's very important is that my son is actually took step two and then was the editor on my step two book, which is a very good thing to have. Okay, so yes, use everything.
So, Dr. Fisher, some people have this conundrum like IMGs. They have limited time in a way that they can either come to US, take step three, and may have one clinical rotation, or they can do three rotations at good places and don't have step three.
Ooh, that's a very hard question. That's a very hard question. It's a very hard question because you clearly put yourself at an advantage at rotations for getting an interview. Number two, about US clinical experience is many program directors ask for it. I don't personally, because since you can't actually touch patients, write notes, and make
Mhm.
decisions, you're really an observer. So my opinion is when I'm on the plane, I don't want someone who says, I can fly that plane. How do you know? I've observed people flying for years.
Okay.
But on the other hand, the fact is that number of people expect it. A lot of programs expect it.
Mhm.
And so you have to do that. The only thing that I would say that's incredibly important is that step three USMLE is a universally accepted coin.
Mm.
Everybody will value it. It's kind of like saying, well, I am an engineer, I'm a doctor, I'm a musician, I'm going to emigrate and move countries.
Mm.
Which country will value which one? And the last person goes, I'm rich. And they all say, every country will value that one.
Yeah. Actually, that reminds me that a lot of countries, including the Middle East, New Zealand, they actually, if you have taken step three, you don't have to take their licensing exams. So I agree that is a very valid point. Very valid point.
I
So
actually didn't know that about New Zealand. If you take step
absolutely,
three, you can don't have to take their licensing exam.
yeah. So they give you, so they you don't have to take all of them. Now in Middle East, they have especially Dubai, they have MOH, Ministry of Health exam. So if you have taken step three, then you don't have to take them and you can just start working there.
Wow.
Yeah.
Well, I'll keep that in mind if I want to go to Dubai to work. Except they don't give you citizenship even if your children are born there, so I don't like that.
Yeah, no, they what they have started doing is giving a 10-year golden visa, which I'm pretty sure they will give it to you.
Well, you see, I've never liked that concept of saying to people that the countries that say that no matter how long you live there, you still have
Mm.
to get your visa renewed every 2 years or every year, or even if you're born there. I think that that's not the kind of humanity we
Yeah.
want.
Yeah,
Everybody should be welcome to go on the Hajj if they want to.
absolutely. So my question is that someone, let's say from Lahore or New Delhi, a fourth year medical student listening to this, now he or she thinks that okay, I'll try to pass step one and I'll try to take as high of a score in CK, and without doing my internship, which is known as house job in Pakistan and India, I'll just fly to US, try to take my step three and apply with maybe zero or 1 year of graduation. Now that person has really good scores, let's say 260 in CK, 240 in step three. Mm, Now, one situation is that person has no US clinical letter at all. It's all from India and Pakistan. Now, would you consider that person for an interview?
I would, some would not.
Okay.
Okay, so that's one of the ones that's mixed.
Okay.
The other thing is there is no clear place to find where to find a U.S. clinical experience.
That's the biggest problem.
It's well, I years ago I was approached with people in my own hospital about setting up clinical rotations that people could pay for to be in. And it became clear from the first minute that people had an expectation that they were buying their way into an interview. And so from the very first rotation, I stopped participating because I felt emotionally obligated to interview people,
Hmm.
and it gave a feeling of conflict of interest.
Okay. And
Uh,
very interesting.
but there's no play. That's the tragedy of it.
Hmm.
Program directors want U.S. clinical experience, but then they don't make it clear where you can get it.
Exactly.
And then then you're taking a doctor from a country where they're making $300 or $600 a month and asking them to spend $300 and $400 a week on U.S. clinical experience.
Yes. And that too is not legit. So the problem, Dr. Fisher, what I've seen is I'll give you one example in psychiatry, your own hospital, Brookdale. So they have a formal hands-on externship program, which they have had for years. Similarly, St. Elizabeth Hospital, one of the oldest psych hospital in BC, they have that too. Now that's formal. I have yet to find a formal hands-on externship program for internal medicine, and I have actually been actively looking to advise people. So I have
It's
never found it.
impossible because it's against hospital bylaws. You can't be doing a hands-on fellowship or experience unless you are privileged through the hospital, and you can't be privileged unless you're in a training program or licensed.
Hmm.
So it's impossible. The liability issue makes it impossible.
Mm, okay, I understand. So basically, what you're saying is that you would still offer an interview, but as you said, and I have noticed too, there are a lot of people that without any U.S. clinical letter, and that could be the one thing. Of course, I want people to know that U.S. clinical experience per se means that it's a hands-on thing. When they call USCE, and observership is technically not that, but it's still the second best thing because that's what people get.
That's exactly right.
Okay. Now, uh, very high step two score, 260, 260 plus, no step three, or 240, or let's say 250 CK with step three of 230. Which one would be preferable?
Ooh, that's a hard one too. Because the things filter out predominantly for step two, I think that what ends up getting more held in more esteem is the higher score on the step two.
Okay. All right. So the filters would at least be above 250. That's what my understanding would be. Okay.
Yeah.
Okay.
You see, the hard part is how do you find the people with lower scores that are still terrific?
Mm.
So, for instance, um, we have 55 PGY1 spots, 55 internship spots,
Wow.
and um, uh, and 40 of those stay and take the boards. Getting 100% pass rate, I don't think is the world's most amazing accomplishment. Because if you chose all people who had 250 and 260, you
Mm.
could put them in the parking lot for 3 years and they'd pass their boards. I think the accomplishment is about 20% of our categoricals are people who had low scores or who even failed,
Mm.
who we kept into the training program. And that's where really the accomplishment, because we were able to pick out people who had special qualities
Mm.
that ended up being more than their scores. So when I'm at the program directors meeting and when you're at the program directors meeting, respectively, everybody's talking about holistic review. Look at the whole person, holistic review. And
Yeah.
I always get very upset. And I said, look, you guys, we let step one go pass fail. What replaced that score? What
Mm.
was the alternate metric that replaced it? And they go, step two. I go, that's not a replacement.
Mm.
I go, if you have two, if I blind you in your left eye, and I go, what are you doing to replace it? And you go, well, you've got your right eye. That's not a replacement. I just lost one. And so the interesting thing is that those people who talk about holistic review, and here it is late in the year, it's the middle of May, and I still have 5 interns who are prelims that don't have advanced spots.
Oh.
And I wrote to the program directors and still said I still have some great people. And somebody who I knew writes back, well, I looked at them. They sure have lousy scores. I'm like, wow, was that the diversity, the equity, or the inclusion?
Oh my God. So, Dr. Fisher, that was my next question. So, it seems that you do interview people with low scores, with even attempts. So, how, if they're not going to pass the filter, then how you give them interview? How does that happen?
Yeah, so the ones with the low scores, sometimes they are people who did research around here.
Hmm.
Sometimes it is every program gets many people referred through people who are in the program or around the program. I mean, I get 400 referrals just from inside the building. We don't, some one year, we don't, might not even have to do any outside interviews. We just take from all the husbands and wives. Maybe we can make it like mitosis and just split.
Yeah, understandable. Understandable.
Uh, and sometimes it works like that.
Mhm.
I met a guy at the IMG event who'd been coming for 2 years, and he seemed a very likable guy, and so we gave him a shot.
Okay.
And we gave him the offer. He said, "I can't come to the hospital. I'm doing something. I have to be in the hospital." So I said, "Come on Zoom. You're in the hospital." And we made him the offer. It turns out he was in his wife's room, who was admitted to the hospital for something very severe. And so the guy starts crying, and the wife starts crying because he now got saved because he had been 7 years waiting.
Wow.
So one of the things I'd like to actually say on that is that the overall match rate for international graduates is actually going up. How is it that so many new US schools could be opening,
Mhm.
yet the match rate went from 45, 48, 52, 55? In the last 2 years, it's been 60%. Now, that 60% match rate also includes people who've been in the match for 5 years. It
Mhm.
includes people with multiple failures.
Mhm.
It includes people who shouldn't match. It includes, like, various amygdalar lesions and Tourette syndrome. I mean, they shouldn't match. 60%. But I must say to some people something that's uncomfortable for a bunch of people, which is if you are 35 years old and you've gone 3 years unmatched or 2 years unmatched, and you have low low scores, and you're just not going to make it. That part you started out with about being honest also involves telling people uh, that you maybe you should do um, maybe you should do something else. Maybe you should do PA school,
Uh-huh.
nursing school. So I had a guy that did pathology assistant school,
Mhm.
and he worked in the hospital as a pathology assistant. And during COVID, he was so damn helpful that he ended up getting the residency at the age of 45.
Wow.
But that's a very rare story.
Hmm.
Now, my friend, I have to go because I'm being summoned to the CEO's office to talk about our new pulmonary critical care fellowship.
Okay.
But we can speak again. Everything
Absolutely.
can't go in one time. Break it up into multiple small bites.
Absolutely. That's what I think that's what we wanted. That's what we would do. And I'll catch you again, Dr. Fisher. Thanks a lot.
You sure will. Okay. I'm delighted you're doing this. It's very important for people. Okay.